Canada has a homeless crisis. Locally, in the city of Kawartha Lakes in Haliburton County, there are about 100 homeless people on any given night. People are being asked to stay at home to help slow the spread of coronavirus. But what happens when you don't have a home? Housing Services in Kawartha Lakes has adopted a rapid rehousing program, which helps individuals and families experiencing transitional homelessness find and move into a new home.
In short, what the program is we're looking for landlords to offer units. We help do matching between the landlord and the person who is homeless or the family that's homeless. There's incentives to the landlord up to $500 for them to prepare the unit if they need that. Last month's rent guarantee, and then the first 3 months of rent up front. And we're also working with paramedic service so that anybody moving into a unit is tested for COVID before they go into the unit. Benefits for the tenant are they have some rent paid up front, but then ongoing, we're actually linking them as well with some kind of ongoing benefit. So primarily the Canada-Ontario housing benefit, which is a monthly benefit paid to them that could go as long as the next 9 years. So it falls under that national housing strategy.
I'm the Homelessness System Coordinator, and what that means is that I'm responsible for managing the list of people who are experiencing homelessness and determining what their eligibility is and what their needs are. So we assess people using a common assessment tool, and then we prioritize people for housing and supports based on their score. So I have this list and I'm able to see who would be a good match for our particular housing programs based on their needs. So the benefit of the Rapid Rehousing program is that it's fairly flexible in that we really try and get to know what the client needs on an individual basis. So for example, a single mother might need support to reconnect to the child's benefit. Someone might need some support with developing a budget so that they're able to maintain their housing. Someone might need support with knowing what their landlord-tenant rights are so that they can advocate for those rights. Someone might need support for their interpersonal skills so that they can maintain a good relationship with their neighbors or their landlord. So it's really a range of supports, and we try and make them person-centered and individual to the clients that we're working with.
A number of years ago, we started really concentrating on getting to know who was homeless and then working towards matching them with housing and any housing support services that we find that they need. So we do an assessment on them called a VI SPDAT, which goes through a number of domains that helps us gauge what kind of housing they need and what kind of supports they need.
The way our system works is kind of like a triage system at the hospital. So when you go to the hospital, you go to the triage nurse and they assess you for how severe your needs are. And then you're prioritized for housing, or you're prioritized for care based on what your presenting needs are. So someone who has, a sprained ankle is going to be prioritized for care at a different time and for different type of care than someone who goes in maybe with a heart attack, and they're going to be prioritized more quickly and for more ongoing care. So our tool, our assessment tool, works kind of in the same way. So we get a sense of what people's needs are and what kind of support they'll need to be able to maintain their housing long term.
The VI SPDAT tool categorizes people into 3 categories: low, middle, and high acuity. Those who have a low acuity score, 0 to 5, require little or no support and are able to find housing on their own.
Then we have the middle acuity score, which is people may be needing just some short-term case management support. They might need some connection to an affordable housing program or an affordable housing benefit. And then we have the higher range acuity people, and those people are really being prioritized for permanent supportive housing. So that's a recognition that they will need ongoing support to maintain their housing. For this program particularly, we're looking for people who are lower to middle acuity. So people who kind of just need some short-term supports, and they're mostly around financial support, affordability of housing to get back on their feet. So we provide a connection to the Canada-Ontario housing benefit, and then some short-term case management to make sure that the landlord and the tenant are a good fit and that it can be a long-term tenancy.
The summer of 2019 brought to the forefront the homeless situation in neighboring Peterborough when tent cities developed due to a homeless shelter closing its doors. Lindsay, however, doesn't have many homeless living on the streets.
We have really hidden homeless here. Being a more rural kind of geographical area, we do have a 19-bed shelter, so a place called Home is the only emergency shelter that we have for the region. And we also see a lot of individuals that couch surf, so they stay with family or friends for periods of time, sometimes shuffle between a number of family and friends.
So I think it's really important to always understand homelessness in the context of the bigger structural and policy issues that cause the crisis that we're in right now. So the federal government stopped investing in affordable housing in the 1990s and didn't start reinvesting in affordable housing until 2016. So that created a huge need in our community and in most communities across Canada. And so that is creating a large barrier in terms of people being able to afford their housing. So in the city of Kawartha Lakes in 2016, 51% of people were struggling with the affordability of their housing. So it's really difficult for someone who's experiencing homelessness to be able to afford any of the housing that's available. And that's why the connection to the Canada-Ontario housing benefit, which is part of the Rapid Re-Housing program, is a really important component of the program because it addresses one of those structural barriers that we're facing.
All three levels of government have come through with funding to help the homeless because of the pandemic.
The social services relief funding, which is more one-time relief under COVID, is $1.8 million. Right now it's to cover a fiscal period of when the emergency was declared near the end of March, and it will go to March 31st of 2021. We also have other provincial homelessness dollars on a more regular basis of about $1.5 million annually, which supports both the homelessness system and any eviction prevention, housing prevention supports. And under COVID, a place called Home was also successful in getting some of those federal funds, so just around 80,000 through that federal. The municipality also contributes homelessness funding between the city and county of about $500,000 annually.
So the Rapid Re-Housing program started in May, and it was a response to the pandemic. So it became very obvious, if it wasn't obvious before, that housing is healthcare, and that people need their own housing to be able to maintain their well-being and their health. So with this program, we are hoping to move people as quickly as possible into housing so that they can maintain their health and well-being.
On a normal night, a place called Home would be at full or over full capacity. During the pandemic, the problem of physical distancing closed down a place called Home, and the homeless were moved into motels.
So we recognized early on that the shelter's physical space couldn't meet some of the health requirements, so physical distancing, they're sharing washrooms, for example. So we started using the motel system. And so what we've saw is that a number of individuals that previously would stay at the shelter or could couch surf weren't able to do that. So we've actually seen more people coming forward right now.
However, motel costs have come with a price tag ranging from $60 to $120 a night for just one motel room. Times that by 60 rooms currently being used to house some homeless people in Kawartha Lakes.
In addition, a place called Home has been successful in getting some federal homelessness dollars, which are called Reaching Home, and they're using those primarily to set up shop, for lack of a better word, at the hotel where we have the most units. So so that they're able to be more on site, they actually rented like a travel trailer and put it on site. so that they're more involved with the motel stayers there. But right now it's totally empty because we're not able to use that physical space and meet any kinds of the requirements. There was one family staying there, so it was one family unit of 7 people. So we left them in the one building at a place called Home, but it's very nice that they were actually housed through the Rapid Re-Housing program quite recently.
When we come back from the break, I talk with the landlords who helped the family with housing and why they signed up to be landlords in the Rapid Re-Housing program. Before the break, we discussed the need to find homes and the logistics behind the Rapid Re-Housing program, which is part of the National Housing Strategy. Over 35,000 people across Canada are homeless on any given night, and 235,000 in any given year.
Not having a home on a good day isn't bad. I'm sure everybody can realize that we're all being told, stay home, self-isolate, quarantine, and we all have a home to go to. These individuals and families don't have any place to call home, so you can imagine the heightened anxiety. They already have lots of anxiety around being homeless or the situation that's made them become homeless, but now there's that added of, how do I meet these requirements when I don't even have 4 walls to go stay in? Finding the units is probably the biggest obstacle.
Over the past 20 years, we rented to Sir Stratford Family College students, and it's worked out well for us, but currently with the COVID cases going on, we currently do not have any interest in renters at the moment because everyone's up in the air about what's going to happen in September. So the home is, it's a raised bungalow style, and there's stairs going up from the outside into the main level as well as through a garage entrance into the main level, and it has a fairly large kitchen and dining area combination, a fairly large living room. It has a 4-piece bath and 4 good-sized bedrooms. One's smaller than the others, but the other 3 are quite nice.
I think the important piece to consider with this program and the programs the housing matches that we've been doing in the past is we're trying to connect support services too. So although the relationship is between that landlord and tenant, we are there as a support. So when I say we, the city has some community housing support workers that can help the landlord and tenant through some difficult times.
Well, they looked into people that were in need of housing that had gone into maybe some hard times of their own, but were still very dependable people, and they offered us, I think we had 3 different opportunities to interview 3 different families.
Where the landlord could just rent the unit off the street to anybody, may fall into some of those same kinds of situations, whether it's someone who's come from a housing situation or not from a housing situation. At least there's some guarantees that there'll be some supports there for the landlord that they wouldn't have in a normal tenancy situation.
Well, we're early into it, but the alternative was to have no rental at all. And this way we have some people in there, like we said before, with some support. And it helped us find a family, because I don't know on our own how difficult that might have been to rent it.
As we really like to concentrate the program on a self-contained unit that falls under the Residential Tenancy Act. That really gives the tenant some stability of tenancy. We have had people come forward with rooms. So we will look at those as well too. So we have probably 5 or 6 rooms that have come forward, and then 4 or 5 actual self-contained units.
The Rapid Rehousing program is geared to helping those with low to mid-range support needs. Financial support is usually necessary rather than addiction or emotional support. Under the Rapid Rehousing program, the first 3 months of rent and also last month's rent is paid directly to the landlord. Also, the landlord can receive up to $500 to make any upgrades or repairs to the property.
And they are getting financial support initially with their initial rent monies to us, and the money came directly to us, which was also a nice benefit, not wondering if everything was going to be cool with the rent and the money that we received. So yes, it went right into our account, and we were very pleased about that as well.
I think generally there's a large stigma attached to experiencing homelessness. So I was talking to one of the housing workers yesterday, and she was saying that almost every person that she works with has experienced some kind of major trauma in their life. And we know that at least 40% of people in the city of Kawartha Lakes experienced homelessness as a result of abuse or trauma. And so there's this expectation that people can just, pull themselves up by their bootstraps, address their mental health and other issues, get a job, but that's actually really difficult to do if you don't know where you're going to be sleeping at night.
Well, I guess I'll speak personally for my perspective that homeless to me meant something different, I guess, than I sort of put everyone in the same peg, I guess, that you might want to call it, that I guess I viewed homeless people as people that live on the street more than being in different situations. So this has opened my eyes that there are other forms of homeless people other than just people living on the street and drifters, I guess, type of people. That's where my perspective was. So this will hopefully change my mind and all that, and so far it has.
We were not sympathetic to things that can happen to people and families that, through no fault of their own, things happen and you're at a disadvantage.
Rapid rehousing actually means that you're setting someone up that needs some more shorter term financial assistance and some shorter term supports.
So this program is ongoing, and that's the benefit of the program, is that the Canada-Ontario housing benefit will be attached to these the recipients long-term, so they will be able to maintain their housing long-term. And the other benefit is that the case management support is intended to stabilize people so that they're at a place where they can maintain their housing on their own. So this program won't go away once the pandemic is over. It is an ongoing program, and the intention is to help people move out of homelessness and stay out of homelessness. We want to make sure that any episodes of homelessness in our community are short and non-recurring.
When we return, we will look at the Kawartha Lakes housing programs, which helps people who need long-term support and are not a part of the Rapid Rehousing program. Kawartha Lakes has a 10-year housing and homelessness plan to improve access to adequate, suitable, and affordable housing for all of its residents. However, the COVID-19 pandemic added a crisis to the homeless crisis. In addition to the Rapid Re-Housing program, Kawartha Lakes is using the Housing First model to help the high acuity homeless or those who need long-term, ongoing support.
The residential side of 68 Lindsay is what we call permanent supportive housing. It's built under what we call the Housing First model. Just what that means is that people don't have to prove themselves in any way, so they don't have to go into a detox center and, for example, first before then they're offered housing. So when I talk about acuity, the individuals who are housed at 68 Lindsay fall into the high. So the score goes from 0 to 17, 17 being the highest acuity, the highest needs. Everybody that's housed in there has a score between 13 and 17. So they have fairly complex needs. And what Forecast is working on through the Housing First philosophy is 5 stages. So it's all related to making sure they have a successful tenancy. So pieces of it down the road may be realizing that they have an addiction, and because they have an addiction, that's leading to them becoming homeless or their tenancy being difficult. So then Forecast could work towards goals.
Forecast is both a strategic partner in that they're part of our strategizing to end homelessness, and they also are a frontline support for people who are experiencing homelessness and are transitioning out of homelessness. So they provide really intensive case management supports for people who are in housing and need support to maintain that housing.
So the higher the acuity, typically the more supports that person needs to retain their housing. So when they're scoring in that higher acuity, we're always looking at matching some kind of support service with them too.
I think it's also important to note that we wouldn't need to prioritize people based on their vulnerability if we actually had all the resources and supports in the community that we needed.
All of the individuals in 68 are what we call chronic homelessness. So they've been homeless for at least 6 months. But I think there were people that were housed there originally that hadn't been housed in years and years. So some of the work that Forecast does is really basic skills around just maintaining a unit. Lots of work around how guests and visitors impact tenancies. You can realize they've probably been living in more kind of congregate kind of settings. They still have friends that don't have housing. So talking about how that impacts when they just can't have visitors and guests on a regular basis. So
COVID is here, and yeah, feel sorry for people that are in the situation that they're in.
The COVID-19 pandemic made it very obvious that housing is healthcare. We were all being asked, we still are being asked to stay at home to be able to stay safe. And people experiencing homelessness don't have that opportunity. They're often living in places that are inadequate, in congregate settings, so there's lots of people staying in one place and they're not able to physical distance. And so the pandemic really made it crucial. It's a crisis on top of a crisis that we need to move people into housing so that they have their own space so that they can maintain their health.